All right. We're ready to the Benton-Franklin Health District meeting today is Wednesday, October 15th. It's 1:30. Call this meeting to order, and we'll move on to public comment. Is there anybody here?
Yes, if you would.
Public comment?
Yes, please.
Go ahead.
Okay, thanks. So some of you may know that the Chamber of Commerce recently held a conference for women in business. And at that conference, they presented 2 awards, the Athena Awards. One is for leadership and the other one is for young professionals. And the Young Professional Award went to Janae Parent. And they've made a video, and I think we have just enough time in public comment to play that.
I've got sound rolling and cameras rolling.
My name is Janae Parent, and I'm honored to be a 4th-generation leader in the community I proudly call home, now raising the 5th generation with my husband. I come from humble beginnings, where my family taught me that confidence isn't about having every answer, but about showing up fully even when the path is uncertain. My grandfather, a veteran of 2 wars, lived by the principle of leaving every place better than he found it, and I've carried that belief into every chapter of my leadership journey. Leadership may run in my blood, but resilience has shaped my voice. Over the past decade, I've risen through environments marked by fear and challenge. And the past 2 years, I've worked to help transform that culture into one fueled by empowerment, curiosity, communication, and accountability. I lead with purpose because I know where I come from. Deep roots, quiet strength, and a fierce love for this community. I hope others would describe me as a compassionate and empowering leader, someone who leads with heart and never forgets that people aren't just part of the work, they are the work. I believe in motivating others through curiosity, by listening deeply, and by making space for people to bring their ideas forward. True motivation comes when people feel seen, valued, and trusted. The values that guide me are integrity, humility, service, and courage. Integrity is doing the right thing even when no one is watching. Humility keeps me grounded and reminds me to listen more than I speak. Service means leadership isn't about the spotlight, but about lifting others up. And courage means not only making bold decisions, but asking hard questions and staying true to your values, even when it's not easy. I am humbled to receive the Athena Leadership Award. This honor is not just about me, it reflects the women who lifted me up, mentored me, and walked beside me. To every woman who has ever questioned her worth or her place at the table, you don't have to worry about being perfect. You just have to be willing. Take that step, and the world needs you.
Anybody else? Anybody online?
If you'd like to make a public comment, you can either raise your hand inside the Zoom app, or if you're on your phone, you can press *9 to raise your hand. Dr. Kwandi is online with us.
Hello, everyone.
No one else in public comment though?
Not seeing.
Okay. All right, we'll close public comment. Move on to senior staff comments, if any. Nothing? Okay. New business. Dr. Krager.
Good afternoon. Can you hear me okay?
Yeah.
Awesome. All right. I just have a couple slides. I hope you all are enjoying the fall. I enjoy getting to wear a sweater now and then. All right, do we have my slides?
Yeah.
Unfortunately, fall also means respiratory illnesses like influenza, RSV, and COVID-19, as well as plenty of others. There's been just a lot of general colds and common cold kind of going throughout the community. So a lot of people sick. I still can't see my slide. Is that
Sorry.
me? Or
I was not
something?
prepared. 1 second.
That's okay. No worries. So I'm going to touch on that briefly, and then I have a short update on bird flu. Perfect. Thank you. So just a couple highlights. We talk about these three main ones, and I think the main reason public health focuses on these is because we have vaccines for them, but obviously there's lots of other respiratory diseases circulating. But influenza, we had one of our worst influenza seasons in a long time last year, 280 childhood deaths last season, which is the second most since data collection started. The first was H1N1, a pandemic year, when there was 288. RSV, we have a newer vaccine for, which is wonderful. It is the #1 cause of hospitalizations for infants, I think under 6 months. But we've seen some clear evidence of that rate of hospitalization falling after vaccines have been introduced the last couple of years. COVID-19 remains. Every year we see less and less kind of severe illness. But still over the last year, we still saw hundreds of thousands of hospitalizations across the country due to COVID-19. So I still think it's something worth talking about. All right, let's go to the next slide. I'm just going to go over the vaccines that we have. Influenza. Again, I bring up the pediatric deaths because I think it's something that not everyone thinks about. If you're a child, you may be susceptible to severe illness. People think about people who are really frail, people with immunocompromised, people over the age of 65. But young kids especially can be susceptible to really severe disease from influenza. Of those deaths last year, 90% of them were not vaccinated. So we know that the influenza vaccine provides that protection from severe illness, and encourage everyone to get it. RSV is a little bit more complicated, but essentially adults over the age of 75 or 50 plus with some risk factors. This is a one-time shot right now. We've been collecting a lot of data about how robust that immune response is over time, and it seems to be lasting, which is great. So that age group is eligible, and I encourage people to get it. Pregnant women between 32 and 36 weeks, and that provides a lot of protection to their newborns, which is, again, the most vulnerable period of time for those infants, especially during the winter seasons. And then if you so otherwise it's and then there's monoclonal antibody for infants under 8 months, and then older kids if mom did not get their vaccine during pregnancy. All right, let's go to the next slide. I only have a few today because I know we have a packed agenda. So COVID-19 in Washington State, it is available to anyone 6 months and older who wants it without a prescription. I know there's been lots of questions about availability and who's eligible. We have a statewide standing order that kind of makes eligibility more a little bit easier. It still will depend on your pharmacy and what they're carrying, and if your healthcare provider carries it or not. But we do have the three main vaccines available: Pfizer, Moderna, and Novavax. And again, really encourage people, especially who are high risk, to get a COVID-19 vaccine. We continue to see whooping cough, also known as pertussis, as well as not measles locally, at least not in our counties. We've had some in Washington, obviously. But measles has remained, while it's diminished a little bit from the beginning of the year, we still see a pretty sustained level of measles transmission across the country that we haven't seen in a long time. Similarly with whooping cough, we're at pretty high levels. So measles is really intensive work for public health if that happens. So we hope and pray that it doesn't happen here. but we're obviously prepared if it does. But it is a large response. Measles is extremely contagious, so it means a lot of people tracking down a lot of people who are potentially exposed. Okay, let's go to the next slide. So bird flu gets a little bit of, I think, bad memories for people, some trauma response, I think, in our agency, which I think is appropriate given how much we've seen it the last couple of years. Unfortunately, Grant County, it was reported last week that they have a bird flu infection in one of their commercial poultry flocks. So we are watching that very closely. We're working with Grant County, kind of giving them our expertise as we've, dealt with that over the last few years. It continues to spread in wild birds. I think, our major outbreak that infected humans was in October of last year. And that, probably has to do with migration of birds, why we're seeing an uptick in bird flu kind of activity across the country. Again, just emphasizing the risk to the public is very low. We still encourage people, take precautions around sick birds or other sick wild animals. Obviously, it's higher in people who are working in these facilities and potentially depopulating a flock. But the overall risk is low. It doesn't easily infect people at this point. But I want to encourage people to, be cautious about their backyard flocks as well, and just keep them secure. And then if you notice kind of rapid illness, reaching out to, I think it's Department of Fish and Wildlife. No, it's WSD. Apologize. Let's go to the next slide. Oh, is there a question?
No.
Okay. Great. Okay. Oh yeah, and this was my last slide, which is just again highlighting our Stay in the Loop website, which our staff is doing a great job of keeping up to date, as well as updating with new resources, videos. There's all sorts of good stuff on there about vaccines, so I encourage you to check it out. That's my report today.
Thanks. Next on the agenda is 0.5 FTE request for contract. Mr. Kyle. For Senior Kyle or Mr. Kyle?
Either way. Good afternoon, everybody. I'm here to formally ask for an additional 0.5 FTE for our contracts position. Our current contracts position is a 0.5 FTE, and we would like to increase that to a 1.0 FTE as a coordinator. This position is responsible for all the contracts at BFHD and is currently vacant after a long-standing manager's retirement. We'd like this to be a 1.0 so that whoever comes in has time to get up to speed on our contracts and has some capacity to do some grant applications. We anticipate this position being able to bring in grants for the agency, which would help cover their additional expenses. And although we feel strongly that this position is necessary, even if it is not budget neutral for sometime into 2026. So that is our ask.
I'd also like to say that since this is going from a manager position to a full-time coordinator position, we actually expect that it will be relatively budget neutral since we're stepping down. And then we expect, since we're moving into a seeker position, a seeker writer position, that will be about 2/3 to 3/4 of this job is to help bring in additional programs and services and funding for the health district.
Thank you. Any questions? All right, can we get a motion?
I move to approve that we add 0.5 FTE to the contract position.
Second.
We have a motion and a second. Any discussion? Hearing none, all in favor say aye. Aye.
Aye.
Any opposed? All right, the ayes have it. All right,
Thank you.
thank you. Ms. Lauren, approval of resolution 2505.
You need sign from Commissioner Didier?
No.
Okay.
Very different standing up here, even though I've been coming to these for 2 years, so a little nervous. So this is a resolution to go along with our adoption of a public records policy and fee schedule. And so according to the Washington Model Rules, this called the Public Records Act. Oh, sorry, those are two different things. According to the Public Records Act, we need to have a standalone resolution stating why we cannot do an index of literally all of the public records available. And so this was in the draft packet, so I could either read it fully into record, or I can just do the summary at the end.
Summary.
Okay. Okay, so now therefore let it be resolved. The Benton-Franklin Health District declares that developing and maintaining a single comprehensive index of public records would be unduly burdensome and costly pursuant to revised Code of Washington 42.56.0704 and will not be done.
Anything else?
I think you need a motion to approve.
Yeah, need a motion. Can we do that with, I guess, all of us here without?
You have a form of 5 right now.
I just want to make sure.
And this resolution is not tied to the fee schedule. This is just the
Yeah, we can do
index.
that. Yep.
I move that we pass resolution 2505.
I'll second. A motion is second. Any discussion? Hearing none, all in favor say aye.
Aye.
All right, any nays? All right, guys have it.
Yep.
Thanks. All right, unlicensed mobile food vendors. Sharon.
Yep, yeah.
You got the packet, so we've got some short packets prepared just to go over this issue, so you'll find that in your packet if you want to kind of follow along. We're bringing to you, I know we've had some discussions with some of you on and off through some connections, just kind of highlighting an increasing issue that we've been having in our facility. And this issue is not unique to us. It's possibly probably tied to a lot of issues going on across the state. So there's kind of a dual issue going on there. For me, for those of you who don't know, my upbringing in public health was started in the food safety program. So I spent 15 years squarely in that program as a inspector. So I can speak to that historical experience of we've always dealt with unlicensed food vendors here and there. But what we're seeing and what we have not seen in the last year is very different than what I've seen, over years past. We may in past years deal with unlicensed food vendors at events, people who didn't know they needed to get a permit, or have touch base with people who don't get a permit, but typically they're amenable to working with us on how to go through that route to get permitted, right? Or how to kind of fix what's going on. But in the last year, and we've got a little bit of data here during 2025, we've seen a really sharp rise in unlicensed food vendors. And particularly the conversation today is going to center a little bit around these pop-up vendors. This applies universally to all unlicensed food vendors, but with this group, we've seen kind of an unusual but potentially connected patterns that are a little bit concerning, which is why we're going to focus on those things today. So in general, they're operators that appear to be somewhat organized across our county and probably across county lines. When I meet with my counterparts from across the state, we've been able to universally say, we're seeing this type of vendor, they come in this type of van, they put up this kind of equipment, they have this setup, it is all identical across the state. So that's really unusual. We don't know if they're, they have some central hub and they're coming out of a particular county and going into all these counties, or if there's copycats out there. I don't know. I don't know if there's something deeper. There's a lot of conversations around whether there's something deeper than just food vendors going on, and I can't speak to that. What we're seeing here universally is these vendors lack food safety controls majorly, as in trucking food across the state from Seattle with no temperature control, food in the back of a van with no refrigeration, no hot holding, no appropriate heating equipment, undercooked food. We have been talking a little bit about that. Owners are not present, so this is presenting a big issue for us, and we'll talk about enforcement, because especially as a special purpose district, we don't have code enforcement staff. We, our only enforcement route besides fees or fines, and those are typically affixed with permitted vendors, is to prosecute. And we cannot even get a name of an owner the employees that work at these places will say they don't know the name of them, or they just were told to come work. So we're having a lot of challenges with even digging into what's going on behind the scenes of these operations. They're crossing jurisdictions, they're providing a lot of difficulty with tracking. So they're kind of changing business names, changing banners, changing things about their operation, but it's the same, you know, from week to week. So they're consciously kind of staying ahead of that enforcement, both with code enforcement, law enforcement, and us as well. We're seeing in at least the last 4 or 5 months for sure, we're seeing a huge uptick in complaints from our local businesses. And this is where we're, you know, we have been concerned from the beginning about the food safety aspect of what we're seeing out there in these vendors. It's very concerning. But now we're starting to hear a lot more vocally from our local businesses that it's upsetting. It's threatening their, you know, fair play, fair business. They're paying for their permits, they're getting their inspections, they're doing, you know, taking all the food safety steps to make sure food is safe. So not only does it undercut competition, it's, you know, starting to sort of erode trust in government. And simply, you know, if one of these is going to cause an outbreak or cause an illness, it's going to undercut that that trust that people have in eating out in general. So that's, you know, that's concerning for our local restaurants that are doing things the right way. So Aaliyah here is the food safety program supervisor. So I'm going to have her go over the next couple pages. We've got some pictures. She's going to highlight some of the food safety concerns that we are seeing. These are all our local pictures that we've taken. Talk a little bit about the field encounters and concerns there. And then I want to talk a little bit about what some other counties are doing so we can brainstorm a little bit.
Can I just real quick, I know I was looking through the pages here, and I think that would be something that you, Justice Council, is the type of sicknesses and elements that people get from potential they could get from that. I think that's always important to know so that the public knows the risks that are out there on some of these type of food vendors and stuff too. I didn't see it in here, but I think that might be something to add in the future.
Okay,
they're pretty basic, but I don't know all of them, but I know some of them, but that would be good to know.
Yeah, good idea.
So like Aaron said, it's consistent for these food vendors going out. We've seen multiple, myself, I've been out, I actually took some of these pictures and there is no temperature control, like meats have been cooked somewhere. They have been cooled maybe somewhere and they're coming in coolers, but there's no ice, there's no temperature control for any of those foods. There's no hot holding equipment for any of those foods. And I've gotten that they've come in from Seattle area, but I've gotten that they've come from down the street. I've gotten that they've come from maybe 45 minutes away. And I could be talking to the same person, just a different night. Or maybe it's a different person and they're reporting the same thing. So it's like, seems to be very organized and the foods that they have and they're serving are not safe. And someone could get sick. There's coolers like in the picture here that I've opened that have raw meat in there, the raw meat sitting on top of other foods, and it's just in the cooler. There's no ice, nothing to keep the temperature of the foods that are being served to people. There's pans of stuff. This one looks like it might be sitting on something that's keeping it warm, but it's not. It's just sitting out on the a stainless steel cart. And there's no temperature control for the meat that's in the picture there. Also, there have been some of the complaints we've received that some of the meat is served raw off of the equipment that they have there. That's also being transported without temperature control and being shaved off and served to customers. And they have some equipment that has the ability to temperature control, and it's either not on when we get there, or they're just sitting the food in there, and over time it heats up.
And you know, one thing once again, I'm going to state this again. I know you said that, you know, it could cause people to get sick, but it could be sick and or death, depending on if it's a child or someone that's elderly and stuff like that. So I think it's important because I was also getting phone calls from other counties as well about this issue. So I just want to, it's an important issue. I know that I had brought up, and so I want to make sure that we're just having a full impact of what this can cause, sickness and or death.
Concerning, you know, if you look at this as a food inspector looks at this and I'm going, this is a really advanced level food, right? This is a lot of complex processes. There's raw meats, there's a lot of, you can see that bottom picture with all the produce. That's actually one of the more concerning pictures to me when I see that level of preparation, because there's no hand washing in these foods. There's no produce washing. One of our top causes of illness in Washington and nationally is ill food workers and hand contact. So whether it's cross-contamination or you're showing up and you're ill or asymptomatic, one of our top causes of food illness. So when I see no hand washing, no gloves, no temperatures, raw meats, it's a concern. It's a concern for us as a public agency that's charged with, tasked with protecting this level of safety. And we're, she can talk next a little, I think, about the field approach, because what we've been seeing is we're really challenged in getting in any meeting there with me. So we hear a complaint or we become aware of an issue, we have a duty to go and respond. That they are out resourcing us. There are days when we're getting 6 or 7 of these complaints in a single day, and it takes them about 2.5 hours to complete one of these. So we're out resourced, and we're at the point where we're just sending inspectors out to close the same people week in, week out, over and over and over with no movement or no change. So if you want to talk a little bit about what we have done and some of our partnerships with law enforcement here, I think that'd be helpful.
Yeah, so I worked on getting some connections with law enforcement and contacting them to go out with us, because there are some safety concerns when sometimes the operators get very challenging for the inspectors. It's not a safe environment. Also, some of the customers could get really upset and aggressive with the inspectors when they go out there. So we partner with law enforcement. So each one that we go out to address, we contact law enforcement just for safety, for them to be there. So we can do what we need to do to try to get them to close, but sometimes it's still difficult to get them to discard foods, throw things away, and they might close down and they might set back up after we leave. So when we get a complaint, we plan on going out and addressing that complaint. But as you can see here on this map that's below, the complaints we receive it's scattered throughout Benton-Franklin County. It's kind of everywhere. It's anywhere from Prosser area all the way up to
and Benton City. Oh, I got.
Yeah, Benton City. We just got one last night for Road 44 in Pasco at the gas station. So we're just coming in all over the place. Yeah, it's not unusual for what other counties are seeing, I think.
Yeah, so and they all set up after 7 p.m. So it's between 7 and 10 p.m. that they're actually setting up, and they're serving well into the early morning, like maybe 3 a.m. So it is for resources for staff, for us, and also going out to close one of these operations is 2.5 to 3 hours, like Aaron said. It takes a lot of time to just wait for law enforcement to be able to come out and support us, and then making sure that the operators stop serving food, or discarding food, so they can't continue to serve the public, or they pack up and they leave.
And then there's the law enforcement resources, right? One of the challenges is because they're setting up in the evenings around here, most of our code enforcement offices don't operate after hours, so that defaults to law enforcement. So now we're working with them where they may be, obviously have competing priorities in the evening, especially on weekends. So that's a bit of a challenge, I think, whereas if during the daytime, historically, we can call code enforcement, they'll come with us. We have a little bit of extra support, safety for our staff. We usually only do that in cases when we've had an encounter that's either aggressive or we want our inspectors to be safe. It's not a default for us to call law enforcement, but we've had a couple of encounters with these that have caused us to be a little concerned and to continue to send our staff out after hours. So you can see the difference in the complaints. We're not even done with 2025, and we're already up 51% from 2024, and our complaints for unlicensed food vendors are up 75% from 2023. So by the end of the year, we'll probably have double that. So it's definitely increasing, sapping our resources, our staff time. It's an incredible amount of time to conduct these, and again, it's just kind of continuing to undercut food safety. So I mentioned that others are facing the same thing, and I mean the same exact thing where a lot of counties are suspecting that it is not an issue unique to us, or not a vendor unique to us. Last we met, Washington State Department of Health is has been made aware, and they're aware that we need help and that we feel like this is bigger than just any one county. So last, we had some environmental health meetings with the state. They are working with the AAG's office to kind of seek some interpretation on legal tools. I don't know if there's gonna be any enforcement support that's gonna come from the state. There's gonna be support probably in the way of, here's how we advise you handle it, or here's how you can handle it. So they're seeking interpretation on legal tools, what we could legally do, what our law enforcement could legally do, whether we could embargo equipment or, you know, take certain steps. They're also trying to work with a couple of different divisions of the AAG's office to work different angles, human rights angles, L&I angles. But that's still in motion. We don't know what's gonna come of it. They're kind of at that, we're knocking on the door stage to see how we can help you. Some other counties, many other counties are working with their law enforcement just for field support, safety support, code enforcement support. If you flip to the back of this page, I've kind of done a little summary of what some other counties have reported on more recently. So a couple of months ago, the city of Sela is the first one that did this. The city of Sela passed an emergency ordinance in their municipal code that allows them to take direct enforcement action against unlicensed vendors. So penalties, including equipment confiscation. One of the issues that has been brought up is that the owners of these facilities aren't ever working in the field. And in some counties and in some cases where we've encountered, some of the employees say, I don't know, I just was told to show up, it's working. And so that concept of ticketing them for showing up to, you know, to do their job and make money is a little bit difficult. So I think they've taken that tack of confiscating the equipment so that the operation can't continue, but you're not penalizing the people who were just told to be there to work and do their job. Because obviously there's a lot of other, you know, sensitive issues that this presses up against right now. So that was City of Sela's tack. And I will say that many of our local municipal ordinances, City of Kennewick, Benton County, already have provisions worked into them that say food vendors operating in the city, in the county, whatever, have to have a Benton-Franklin Health District permit. Just doesn't address the penalty angle and how it can be penalized. And so that has caused, I think, law enforcement to be unsure maybe, or we're talking it through with them, right? What their authorities are here to kind of not enforce our code, but enforce it through your municipal code.
And I think what we're looking at doing, because I know we have talked about this and in my district, it was part of this city.
Mm-hmm.
By golly, I got a few calls and those people were not happy about this at all. And throughout the day and the nighttime there, and code enforcement was, you know, not there.
Mm-hmm.
I think the mayor went over there in Benton City, talked to the person, because it was a pretty significant setup. I mean, they had all kinds of stuff. There was big. And they got a little bit aggressive. And so I think it was eventually shut down the next day. But I think what we're looking at doing, and that's why I always said, if you guys wanted to talk to the Law and Justice Council, which, you know, that's all the city attorneys, the prosecutor's office, Office of Public Defense, all the police chiefs, some of the commanders throughout the entire county. I think what we were looking at doing with the PA's office, prosecutor's office, as well as with trying to get everybody on board, including the city managers, is maybe we tighten up and we can always increase and put other code in there or law into place in the county. And I think we may do the same thing or follow once we get legal advice to do something that the city of Sela has done, because it has more teeth to it. I don't have a problem, and I don't think Commissioner McKay would have any problem with any food vendor coming there, as long as they're following the law and making sure people are safe. But when I look at sickness and or death, because some of those things could cause that for a kid or anybody else, I think that's important. So I think as you guys, you know, talk to Chris Corral, the Chief Corral over there at the City of Kennewick, set that up, let everybody hear that. Maybe we all, with the cities within the county and the county, come up with a way we're all uniform across the board. It'll make life easier for you guys as well. And that will get law enforcement and support too.
Yeah.
And maybe I think that's a good angle. And maybe that will get them in line when they come here. Sure, set it up, but have all the proper you know, safety items in place.
Yeah. Yeah, I think that's an angle we would like to lean into, just explore that with that kind of on what would be feasible. What's the, you know, what's the the most rational direction there, because we don't want to set up anything that's overly punitive, right?
Yep.
When we approach unlicensed vendors, when we bump into them for the first time, in fact, we won't shut you down if you're operating properly. If all of your safety is in line, and it's a matter of a piece of paper, the first time we bump into you, keep going, come into the office, pay, but you need to be set up safely,
Yeah.
right? So that's a different issue when you have no hand washing, when you have no temperature control. We can't allow that to continue. So setting up something like this, I think just allows that flexibility. We've noticed that some talked to Walla Walla a couple days ago. They said they only have one, you know, so. But they went to their Board of Health and their law enforcement has been trespassing people off of the properties. I know we've explored that with
Yep.
City of Kennewick. So I think just figuring out what tools we can use to say, hey, because like the one we got complained about last night on Road 44 is they're popping up in the parking lot of a gas station, which is a permitted food establishment with us. So that's one, that's competition. We've had that happen, and then we go to the food establishment and they go, I just thought they had a permit, so I told them they could be there. So I think a lot of them are going in and selling themselves as these legitimate operations to convince. We've had them set up in grocery store parking lots of other food establishments. So working through that. So a lot of counties are just using public information. This is something we wanted to sort of throw out there and explore, because Seeking, Tacoma Pierce, a couple of them are going now to publishing restaurant closures on their website. We will be open to exploring that. We already published our inspections. We have a very consistent enforcement policy by which we're very consistent line for when we do or would close a restaurant. Usually it's because of a imminent health hazard, pest issue. But an unlicensed operation like this, right now, would not get posted under those current inspections. So it's something that we're open to exploring to give the public choice, right? Because part of the issue here is we're looking at a conversation of what's a risk versus what's a hazard. The risk being something the public knows they're taking. But in this case, they do not know what's going on behind the scenes. And so we're very concerned about that. And at least in the meantime, until we came up with some enforcement options, that gives the public that notice and that choice to, they can still go there if they would like, but at least they know the choice that they're making. So open to discussion if anybody, feels that that's not the direction we want to go, but we've talked about it with our health officer and our group, and we're willing to explore that angle as a stopgap until we can come up with something else. Spokane, they're sending notices to the owners of vehicles, so they're photographing license plates and just having their attorney send them legal notices. Snohomish is doing cease and desist orders. All of these are, have not panned out to completely stop the issue, but cobbling them together is what they're trying at the moment. Yakima County, right now, I think is the county that's working most extensively with their law enforcement, because they're doing similar to us where law enforcement is partnering with them on the field visits, but Yakima County is the only county that's actually worked with their law enforcement's detective division to actually investigate the business, because there's some suspicion that maybe the hub is there. So that's an interesting angle, because we can't get information on the owners, and so Yakima PD's detectives division has been doing a little bit of investigation there. So another approach would be kind of over to. So that's all I know that's a lot, but it was, something we wanted to kind of bring here for discussion, and just, as we decide which angle we take, this is, it's sensitive in a lot of ways, and we want to make sure that you're both informed and your idea to the solution building here.
No, I think that's another thing too. I think, I don't know if Wes is still online or not for Franklin County, but that would be also something I think that, Benton County and Franklin County need to probably work together on, as well as the cities, Pasco and stuff, to try to come up with a plan for it and everything with the cities and the county together.
I like the idea of the council, because it's been a bit of a whack-a-mole situation, and trying to go to each city or each municipality and try and explain everything that's going on, to be able to have a venue where we can broadly share to the whole group that is in Benton-Franklin. I think is a great idea.
Yeah, I mean, even if, when you talk to Chief Guerrero, maybe he reaches out to Franklin County if he wants, and then also City of Pasco and stuff, and see if they're welcome to go to that law and justice council and That way they could hear it straight from the
Yeah,
horse's
is that-
mouth per se.
Is Benton County Center, the council?
Yeah, I believe so. But like I said, I think if that's gonna work, why not? I mean, that would put everybody all in one place potentially. Education is always good.
You started by saying there was a pattern. How was that established? How was the pattern recognized?
Well, oh, you mean like across the state or wherever? Is there one here? I mean, yes, I think the pattern as in we're seeing the same vendors pop up in multiple places, same. You can talk a little bit about the vendors.
So same types of food, the foods pictured in here are actually, some of them are from different encounters. So it's the same types of food we're seeing the El Pastor on the piece of equipment there. It is like a vertical broiler and they all have that, the same like salsas, the same agua frescas, they have the same, just the exact same menu, same setup, tents. Banners get rotated between different people. Some of them look really legitimate. They have like t-shirts with their business name on there, a logo, and banners that have names on it. Occasionally you will find one that has a different name, but it might be the same people you shut down last week. Different banner, different business name, same people that you're having the encounter with, so.
And then we brought this to, I meet monthly with environmental health directors across the state. We brought this to a meeting and another person said, hey, we have that. And somebody showed a picture and said, hey, we shut that business down. And then all of a sudden 9 or 10 of us in the room said, we have that exact same thing, the same white van, the same this, the same. We reached out to Department of Health. In fact, Department of Health put together a guide. We were gonna bring it, but it was an internal document, but happy to send it to any of you if you want. So they kind of put together a compendium of what local health jurisdictions were seeing across the state, and that's, we noticed it was not just us.
And then on a final note, if you do talk to Chief Guerrero, just let him know, because he's gonna go, what does this commissioner think? And it was, if you're going to, and if he's going to invite them, I'm only looking at them as an invitation to hear this, not as being members of the Logistics Council for Benton County. Just want to make sure I clarify that.
So part of the reason I asked is that you said the banners change readily, and then you mentioned license plates. I can change mine 6 times. I've got junk license plates all over. So I'm wondering if the vehicle identification number is being reported when these are problematic. Because that's a little tougher.
Yeah.
That's a little tougher to alter.
But we don't, I don't know that we have access to that. They're not operating like mobile food trucks, like on the vehicle.
So I didn't
they're
understand
setting up like under pop-up tents. They're bringing things out of the van, setting up tables and tents.
Okay, so
So-
we'll see the wrong picture.
So they're like unloading a vehicle. So unloading a truck, it would like me be bringing all this food on the back of my truck and just setting up. Like it looks kind of like the fair setup.
Yeah.
So there's large pieces of equipment that they bring out and they set up under a tent. So it's not like your mobile food truck, like the permitted taco trucks you see around town where there is a VIN number attached to it or there is an Illinois insignia or something like that. What we're seeing is just the license plate on the vehicle that they're unloading when we go out to see them.
Yeah, and that's what's, another layer of concern for us is that, like Aaliyah said, is some of them do look legitimate, so we don't want also this to get confused with our vendors who are legitimate and we undercut their business as well. So it's very, sensitive. It's like, we wanna put out information to the public, do media, that type of stuff. We wanna be careful about making sure that people understand which of our vendors actually are keeping up on their inspections, their safety, their licensing. So we've done a lot of messaging with our mobile food vendors to say, hey, be really cautious about, you are supposed to be posting your permit where the public can see it. So please make sure you're doing that. So we can empower the public to make that choice when they see the permit or don't see the permit.
And do you make sure the public knows you did a vendor with a permit? Like,
We've done a couple of social media campaigns. We're probably gonna just continue recycling those where we've actually had screenshots of what our permits look like so they understand. Anytime you go to a restaurant, any permitted establishment, they're required to post their permit in a location that's visible. Sometimes that's challenging on a mobile. So yeah, we have done those public campaigns, but you know, that engagement only goes so far. And to certain audiences, so.
And then county health rankings on the agenda too.
Yeah.
Yeah.
Are you guys done? Do you have any other questions for?
Okay, reach out to you. Thank you. I appreciate your time.
Thank you.
That would go like 15 minutes.
Approval of the
Subject ones.
Meeting minute. We skip that.
Yeah, we can come back to that. Okay. We can do it before we close.
So I will make sure.
Just the fees and county.
Yeah.
Hello, everyone. I think some of us have met before, but for those who have not met yet, my name is Hazel Quack. I am the assessment epidemiologist here at Benton-Franklin Health District. I work for Purnell Hodges in performance management. And I'm also a certified medical assistant, so that's another way that I'm able to serve our agency whenever we need that. So today I'm here to present to you a source that we use for data. Slide. So this is called County Health Rankings and Roadmaps. It's also referred to as just County Health Rankings or CHR. It serves as a national tool for us to be able to improve health outcomes for all, and it offers many different tools and resources for public health strategies and implementation. County Health Rankings was started by the University of Wisconsin's Health Institute, and it's also been financially supported through a variety of funders such as the Robert Wood Johnson Foundation. And its purpose is to help not just public health or healthcare professionals to inform community health factors that influence health, but it's also for community members and community partners as well, and to identify opportunities for improvement. The website does offer tools and resources specifically for public health strategies, so that is great. One thing that I should share, one thing I really love about our country and our communities is that every community is different. It's very diverse. And so County Health Rankings and Roadmaps is designed so that any community, no matter its size or location, can use the information to better understand health challenges and strengths. So at BFHD, one of the data sources we rely on is County Health Rankings. It helps to inform us for data-informed decision-making. It also helps in identifying health disparities, community strengths and assets, and it provides a variety of data and health outcomes and health factors. But strengths is something that I want to speak specifically on. Community strengths is an important characteristic that we follow. And so when we're looking at health data, strengths are a key piece of that data. By looking at strengths alongside challenges, health professionals are able to design health initiatives that are realistic, culturally appropriate, but initiatives that build on what communities are already doing well in. And so through this, we're able to identify areas for collaboration and increased community engagement. The community health assessment also includes data from County Health Rankings. It was one, actually many data sources that we used for the assessment. Side note, you will hear more about our community health assessment next month, so stay tuned for that. Really excited. This data is updated annually, and as more data becomes available from those other sources. So the site is continuously a dependable national source of information. The pictures here I wanted to share are from our in-person forum for the community health assessment. It was hosted by BFHD and it took place at Southbridge Hospital Trios. Shown is my manager, Purnell Hodges. It was a great event. It was well attended. This event was a great opportunity to connect with community members and partners about health outcomes in our community. So these are some measures that County Health Rankings offers, and I have Benton County on this slide, and then I will show Franklin counties. So based on our two counties, this is summarized data about the county. So it's a part of what's called the snapshot. And every state and county has a snapshot that you can look at and compare. So for Benton County, this county is doing slightly better than the average county in Washington State for population health and well-being. This is called a Skittles. It's kind of funny, a Skittles graph. And so Benton County is the one with the darker outline. And so it is doing slightly better than the average county in Washington State, and better than the average county in the nation. And for community conditions, which is on the right side, Benton County is about the same as Washington overall, but slightly worse than the national average. But that doesn't mean that that's no good, bad. We're not going to pick on ourselves for that. There's always room for improvement.
What does conditions mean? I understand what health and well-being mean. What do you mean by community conditions?
Yeah, so
Because
yeah, no, I love that question. Thank you for asking. So community conditions, actually both of these measures are made up of other measures put together. There's a formula for that. Community conditions includes, for example, health infrastructure. So how accessible is it to get into your primary care physician? I know mine's really popular, so it takes a bit. It also considers provider to patient care ratios, community members who might be uninsured, and then even preventable hospital stays. So perhaps someone needed a little extra help at home because they have some mobility issues, that sort of thing. How can we prevent that sort of condition? Also, social and economic factors. So high school completion rates, and then income.
okay, thank you.
Yeah, no, that's a great question. So I'll go ahead and go to Franklin for you so you can see that. For Franklin County, it's actually about the same as the Washington overall for population health and well-being, and better than the national average, but worse than Washington State for the nation, and for the nation in community conditions. So like I was saying earlier, health changes, communities change, so there's always some sort of room for improvement. And so what this tells us is that while the two counties are very different, they've got unique landscapes, growth, and resources, they both have strong, caring communities and that want to see the region thrive. And so even when things are going well, communities are growing and changing, it's also important for us that we keep working together to strengthen conditions for everyone. So this is a screen recording that I did for you so that you can see how easy it is to use County Health Rankings website. It's got a very easy to use interface. For those who are online, you can just simply go to countyhealthrankings.org and hit play. So as you can see it in the recording, you just go to the website. Let's say you want to click on you want to find out more about the snapshot for your community. It's in that top header, health data, type in your county and state. It'll pop up in the drop-down menu. And this is the snapshot. And like I said earlier, Benton, any county, any state, the country has a snapshot. And so this is where you're able to see more specific measures, but also that population health and well-being and the community conditions as well. There's different sections. And you can even look at, in addition to your two counties, the state, but if you're curious about the United States and how they're ranking, you can also do that side-by-side comparison, which I think is a really cool option feature. And go to the next page because there is a, there you go. Thank you. So I wanted to pull a local example for everyone to refer to. This is Benton and Franklin County's commute. So this is looking at drivers who have been driving alone for longer than 30 minutes. And I think that this is a really important one to look at considering these particular numbers. So this source of data is always shared. Actually, I'm going to go back just a little bit. Just down there below in the blue links are links for more information to figure out if you're curious how these measures come together, all the other different measures that make them up. And the source is always shared. So this in particular comes from American Community Survey's 5-year estimates. Data can be collected over a period, let's say of 5 years. Some, depending on what kind of data it is, it might go for 1 year. It just depends. But this one was based on the number of workers who drive alone. And why is this concerning? Safety, for one thing. I think about my husband who works, he's a farmer, onions, and he drives to a very small town in Oregon. That's a long commute, and he does it by himself. He doesn't have any other coworkers who live in our area. And so there's safety, road conditions, fatigue. So that would be why these numbers may be concerning. And if you're interested about error margins too, because data isn't always going to be 100% accurate, there's always some little factors that play in, like someone didn't understand how to take the survey, for example. They give you an error margin of, for Benton County in this example, 21, I think it is, to 24%. So in there would be around what would be that perfect number. Next slide. So county health rankings is widely used in public health education at the college level, graduate programs. And because it's so accessible and it's so streamlined, and it's got this cohesive framework, it offers a really easy to understand interface for students and then even community members. And it doesn't replace, I want to make that clear, it doesn't replace other sources like the Office of Financial Management or the census. Their information is on here as well. It actually includes, I think, over 30 different data sources. And as a former, but not former certified medical assistant, I see the value in a site like this. One, it being a reputable source of information for patients and community members, but they're able to take this information and make the best decisions for themselves. And if they have questions, they can follow up with their doctor. And this photo, it very much warms my heart. It's our clinic team and nursing students from Washington State University. So not only are we serving our community, but we're also helping to prepare the next generation of healthcare and public health workers through a real world experience. And when dependable and reputable sources like county health rankings are there and available for the students, they're able to learn more about the communities that they're going to be serving. And so through education, collaboration, and access to good data, the future workforce will be strong and ready to go into public service. So I wanted to go through that for you as fast as I could because I know you have quite a busy agenda, but are there any other questions for anyone?
Thank you.
Thank you so much.
Mountains, approval from the mountains. Go ahead.
Move that the Board of Health approves payment voucher number 79-2025 for 85-2025, the amount of $1,179,776.50.
I'll second.
We have motion and second. Any discussion? Hearing none, all in favor say aye.
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 Any opposed? All right, the ayes have it.
Before you do that, one, can you do the minutes?
Oh, yeah. My bad. We get approval of the September 17th meeting minutes.
I move that we approve the minutes from the September 17th, 2025 regular board.
Second.
I'll second.
Okay, we have a motion and second. Any discussion? Hearing none, all in favor say aye.
Aye.
Aye. All right, the ayes have it. And next board meeting will be the week before Thanksgiving,
Yeah, but no,
November 19th.
it currently is. So there's two things happening. One is, since we were not able to have a fee discussion today,
Yeah,
that is a primer for our annual budget.
yeah.
So we will need to have a special meeting to go over the fees that we're.
Yeah, I'm glad you actually, I was actually gonna bring that up too before I close this, to see if there's a way we can. I know we have to give them like the public like a whole week's notice, right? Where if we could do it next Wednesday on Zoom or in person.
Yeah. I didn't know if the board would be available. That was gonna be my next
Yeah.
question, if I could take this opportunity to find out.
I'm available next Wednesday.
Next week, I should be, I'll be out of town, but yeah, I'll call it.
But I do know.
I would prefer like a Friday. Wednesday is going to be tough for me.
So, but is that gonna work for you then on the 24th? Or,
WSPHA. Yeah.
or can it be this Friday?
Hold on, that one. So. Yeah, next Wednesday. In the afternoon, we have a conference that we're going to next week.
On the 22nd.
Yeah, so we could make some things work if we get the whole board, but I heard Dr. Kawandi also say he's not available Wednesday.
Yeah.
So.
I know the Franklin County Commissioners have their board meeting on Wednesday.
Yeah.
Morning, I think like at 9 or 9:30 or something like that.
You guys should still have a quorum, because I fly back on Friday. So I'll be on.
So the 24th work for you guys then? That,
But this is for voting on fees. You really need the quorum of your elected, right?
You'll be available, I won't be available on the
You
20th.
guys are the critical ones,
Most
right?
likely, so I'll be-
Do we have to be there?
I'm not on next week.
So we could go the following week?
Not that I don't love more meetings, but.
Yeah.
You go the following week?
You're talking
like
like
the
27th to the 30th.
Yeah.
Yeah, let's do the 27th then. Dr. Kwandi, would Monday work on the 27th for you? Or actually, well, he doesn't need to.
Yeah.
Yeah.
I wanna give them the opportunity, but yeah, we do need to have the electeds there, and then I gotta take this back to Franklin County and see if this was.
So that's what I would do. Is I
So
would-
the 27th on the afternoon, I possibly can make it, yes.
Oh,
Okay.
But long story short though, if it's just the 4 elected officials making the vote, correct?
Yeah.
So I would reach out to Franklin County to where if you could, because you're available the 22nd of next week.
Let me see here real
No,
quick.
he's
No,
out
I'm out
next
next week.
All
That's
next
why we wanna go
week.
to next, the following week.
So then, yeah, I would just reach out to the commissioners then and say, hey, can we meet the 27th or,
27th to the 31st. Whatever's gonna work.
yeah.
Okay.
And we'll work, and just maybe give us some options on what time works for you guys. We can select A, B, or C, whatever.
Okay, then the next hurdle is our regular meeting for November is set for November 19th. That's
Yeah.
also the week of WASAC and WASAC's conference in Wasalpo.
Yeah,
We will all be out. I'm not sure what commissioners will be at WASAC.
so I just been doing Zoom on that one.
Okay.
Yeah.
Okay. So the leadership will not be here for BFHD.
So
So,
can we change that date by chance?
well, so I was gonna make a proposal.
So do
To
we need
see,
a November?
because usually during this season is we've got the holidays we're competing with. So
Yeah.
my thought
Yeah.
was to give us more time for budget prep is if we could potentially cancel November and then move up earlier in December.
Yeah.
Since we've got
Like
one out
the
for,
first week. in
Or
December.
second week.
yeah, like maybe the 10th. Does that work in your guys' schedule?
I mean, yeah, that would work. The first week would be super.
And then you would look at the third for a board of health finance committee in terms of that, but
Yeah.
review. All right, so I will move those dates and then I'll get in touch with Franklin County to make that happen. Thank you guys.
All right. All right. This meeting's adjourned.
Thank you.